I'm a general dentist in Ontario, New York. I have been practicing dentistry for 27 years. However, I do have a little bit of a different background. I actually was the general practice residency program director at what used to be the Genesee Hospital and then Rochester General Hospital. So my job there was to train the residents. After they graduated from dental school, New York State has a mandated 1 year residency program. So I was able to present to 5 residents, not this big of a audience, but I definitely had a lot of experience with many different type of challenging diseases out there. So I hope I can answer your questions and give you some valuable information. Some of the things that we'll go over is, of course, the importance of dental health, basic oral hygiene, the risks and care challenges specific to PD patients, treating those dental issues, and then specifically removable prosthesis, removable partial dentures, removable dentures. According to the World Health Organization, um, it's about 1 in 5 adults between the ages of 35 and 44 have severe oral problems, gum disease, and about 30%, so 1 in 3 of you around the world, 65 to 75, don't have natural teeth left. This is pretty significant. I think the numbers are definitely going down, but with some of the food choices that our younger generations are making, we are seeing a lot of oral decay. Mountain Dew, energy drinks. We still don't really know the ramifications that the younger people with vaping has, but even vaping has sugars in it. So you don't have to be able to get Medicare in order to have dental disease. Oral disease, such as these cavities, periodontal disease, really affects systemic. People come in and they don't understand why we need to know what their conditions are, what medications they're on. But there is a direct link between cardiac disease and periodontal disease. There's a direct link between that tartar and that calculus that you have in your mouth and coronary artery disease. Direct link between diabetes and poor oral hygiene. Not that you don't already know, but periodontal disease is an infection of the gums. If it's left untreated, it can cause tooth loss and a risk of infection. The worst thing that we want is for an infection in the mouth to travel elsewhere and cause somebody who already is immunocompromised to get a huge infection and end up in the hospital. Cavities are permanently damaged areas in the hard surface of your teeth. Basically, the bacteria on your teeth, they take the sugar from the foods we eat and they change it into acid. Even if you're diabetic and you never touch anything with sugar, we have natural sugars in our mouth. We eat starches, we eat potatoes, pasta, fruits. All of those things in combination with plaque can turn into acid. So the end result that you're going to see after today's lecture is regular dental care is essential. We want to reduce the risk of infection. We want to reduce the risk of losing teeth. Prevention is the key. So even if your teeth feel great and you have nothing, no pain. Pain means there are issues. You could have 20 cavities in your mouth and feel no pain. That pain is going to occur once those cavities reach the nerve. Brushing twice a day is key with fluoridated toothpaste. There's also a generation out there that thinks that fluoride isn't good. Fluoride is good. Prescription fluoride is good. You want to have fluoride in your water. Flossing is a huge adjunct to removing the plaque from areas the toothbrush can't reach. I tell patients every day, you can wake up in the morning, take the toothbrush, put it in your mouth, brush all day long. You will never get where those teeth touch. Where those teeth touch, even if it's two crowns, you have to cut that contact. You have to go underneath the gum line. You have to have a professional cleaning to get where you can't see. Rinsing, people think, well, if I rinse with Listerine, I'm good. No, you can't get to those areas. And one of the huge problems with Listerine is alcohol. It's alcohol containing. We know alcohol products increase dry mouth, and we'll go over dry mouth. We definitely want to limit sugary foods and drinks to mealtime. We don't want to be constantly eating all day long, walking by the M&Ms and grabbing one and eating it, because then you're basically constantly giving your teeth a bath in sugar. So brushing and flossing is critical. But
The owner of the gray car with license plate number KMP 9854, your engine is running. Thank you.
But one of the big problems with PD is it requires muscle-eye coordination. So it also requires that your fingers are working and that your tongue and your lips are also working. So if we go to some of the specifics of PD and what you are up against, PD-related rigidities, tremors, dyskinesia can make it hard to brush your own teeth. And these symptoms can lead in the end to cracked teeth, tooth wear, changes in the fit and wear of any type of dentures. If you're clenching all day, your teeth are going to wear down. Swallowing problems, as many of you may know, also accompany PD. And if you don't chew your food well enough, you're at risk for aspiration, pneumonia. You're just swallowing food in bigger pieces than you should. We talked about dry mouth, but over salivation can also lead to fungal infections at the corners of your lip. And the dry mouth, of course, can increase the risk of cavities. There is prescriptions if you end up with the cracks on the corner of your lips. It's called angular cheilitis, and there is a very simple prescription that your dentist or your primary care or your neurologist can prescribe. And then patients with PD have symptoms such as fatigue, anxiety, tremors that can make it difficult to get to the dentist, to open wide during an appointment, to sit through an hour-long cleaning. What I find happens is if you have to cancel, those front desk staff may not realize you need a later day appointment. You need an early afternoon appointment. You need to remind them or make sure that they have it written down. Burning mouth syndrome is one of the hardest things to treat in dentistry. It is not just PD that this can occur. This can occur with many autoimmune diseases, such as Sjogren's. Burning mouth is just your tongue feels like it's on fire and you can't see anything wrong. So it's characterized by painful intraoral burning sensation with no physical or laboratory correlation. There's definitely an increased risk of burning mouth syndrome with PD, especially from the psychological factors, and that can lead to depression, anxiety, cancer phobia, and compulsive disorder. I just had a patient in, and she's thinking she has oral cancer. She didn't even want her teeth cleaned. She does not suffer from PD. But this is definitely out there where patients, they cannot figure out what's going on in their mouth. So as a dentist, sometimes I can also be a counselor to these patients just to make sure that they realize they're okay. The management includes, as I said, cognitive behavioral therapy. Sometimes it is a multi-drug regimens. antidepressants, salivary replacements, and sometimes lidocaine rinses. Of course, in today's post-COVID state, lidocaine rinses are now very, very hard to get. The one company that was making lidocaine rinses for burning mouth has went out of business, and there is a shortage. So what can you do? What can you do at home? I have some of my favorite things up here. The first thing is biotin. Biotin is a great rinse. They have toothpaste, they have a gel. It can help dry mouth. The problem with biotin, when you have it in your mouth, it feels great. But as soon as it's gone, your mouth is dry. Sugar-free lozenges, like the Act. My favorite, Xylemelt. Another one of my favorites is Zellies. Zellies is actually Rochester made. If anybody's been to Phillips European in Henrietta, the owner, Ellie, is actually a dentist, trained dentist from the country of Greece. And she was huge in making these Zellies. They come in a gum and a mint. I highly recommend the mint. They are somewhat expensive, but they're worth it. Small little mints that will dissolve, and you can have them in your purse when you're feeling like your mouth is dry, like I am right now. But you can find these at Wegmans. You can find them, at least last I knew, at Phillips European. So you can go get a good dessert and also your dental mints. And I am in no way related to Allie, but another great thing is Xylemelt. Xylemelts are a little teeny tab, and it actually, one side of the tab sticks to your cheek or your gum. You can put one in at night before you go to bed. You won't choke on it. Huge. Patients will go to bed with that Act in their mouth. That's a choking hazard. We all know that. But with Xylemelt, it actually sticks and slowly dissolves. You can use them during the day. It will dissolve quicker during the day, of course. But at nighttime, it will keep your mouth moist. At nighttime, all of our secretions decrease. That's so we're not getting up 100 times a night to go to the bathroom. But these Xylemelts have made huge changes for patients. One of the big things with dry mouth, which I'll go over, but I want to just go over twice. Dry mouth doesn't mean you don't have spit. Your spit is just not good spit. Many of you may find that sometimes you feel like you have strings of spit. That's dry mouth. Your spit's there. It just is almost glue-like. So if you eat a cracker at 1 o'clock and you don't do anything, that spit is going to keep that cracker all around your teeth. Where if someone that's healthy, that's not on medications, has that same cracker, their spit is meant to wash the food away. So dry mouth isn't just lack of spit. It's having spit that is working against you, like glue. I recommend a lot of patients that if they have that cracker, take water, swish it around, swallow it. You can spit it out, but add good spit back with water. Huge. That can decrease cavities a huge amount. And as a dentist, I don't want the cavities. And I don't want these cavities where they're all at the gum line. There's also, like I said, antifungal ointment that can help with the corners of the lip. It's called nystatin, triacetamide cream. There's also this botulism toxin A. There's injections that the neurologist can do to control drooling. And like I said, we want to avoid alcohol. We want to avoid tobacco, spicy, acidic foods. If you have acidic foods, the problem is that you're adding the acid. So what do we know? We said in the previous slide that the plaque forms an acid and causes decay. Lemonade, huge thing. Sucking on lemons. I had an Italian gentleman that very healthy and tons of decay. Found out he was eating lemon salads, just basically acid in his mouth twice a day. The other thing that helps is these toothettes, and that's on the top right-hand corner here. These toothettes are one-time use. I recommend the ones that don't have any toothpaste on them, but you can actually just keep them in water and just go around to not only wet your mouth, but to help move that plaque that might be at the gum line. Some people think that the toothettes are only for end of life care. They can be used on anyone. They're just a nice way to moisten the mouth. So let's go back to brushing. We already talked about 2 times a day brushing. People will think, well, I brush in the morning. At nighttime, and this is a conversation I have with every teenage kid that comes in the office. Yes, no one's smelling your breath at night, but all the food you ate all day long is sitting there. And if there's anything left at nighttime, when everybody gets dry mouth, it's going to cause cavities. So nighttime brushing, huge. Even if you can't brush after every meal, again, the rinsing with the water, amazing results. Now let's go to PD. You need to find something that's going to make gripping the toothbrush easier. There's all different suggestions. I'm a firm believer in an electric toothbrush. However, with the electric toothbrushes, you might have difficulty grabbing that. You can insert your toothbrush into a Velcro sleeve. You can put it into a tennis ball. You can put it into the bicycle handle grip. There's all different ways that you can add better grip to your toothbrush. And again, the electric toothbrush also adds the weight. And don't be afraid to ask for help. A couple other ways to help with oral hygiene. Prevenant toothpaste. Prevenant toothpaste is a prescription toothpaste. It comes in a booster, it comes in dry mouth, it comes for sensitive teeth. It is 5,000 parts per million fluoride, high-powered fluoride. You only need a dab. You don't want your grandchildren to get a hold of this. It is great. It also is non-foaming. Most patients say, I hate it. I don't feel like I'm doing anything. You don't want a lot of foam. You want to be able to not have a swallowing problem. You don't want added, problems with having to spit nonstop. I highly recommend Prevenant. I use it twice a day. The big thing at nighttime, if you use this, you want to use this correctly. You want to wet your toothbrush first, put a pea-size amount, not a full ribbon, brush, spit out the excess, and do not rinse. If you rinse, you're going to negate this. You want that little film on your teeth overnight. Well, I just told you to use a Xylem. You can still use a Xylem in the corner of your mouth. So, a humidifier in your room. Yes, in the summer, that would not be smart when we have 91% humidity outside, but definitely if you have a humidifier in your room, it's going to help that you're not feeling that cotton mouth when you wake up. Just a little key is to sit down and brush. You don't want to be worrying about your balance. Sit down. You do not have to brush at the bathroom sink. You can brush and spit into a cup if you have to. If you have lost teeth and you have a removable partial or a removable full denture, you always want to take this out at night. Patients feel self-conscious of going to bed without their teeth. Leaving it in is just leaving in something that bacteria can cling to. You want to make sure that they are cleaned properly, especially after you eat. It's amazing the amount of food that gets underneath these, even if they fit great. For partial dentures, you always want to rinse the partial denture. You want to take it out, you want to rinse it under water, rinse out your mouth, even with water if you can't brush, put them back in. Because that food that's going to stick underneath there may be underneath that for 4 hours, 6 hours, 8 hours. What's that going to do? It's going to decay the teeth that are holding that partial in place. And of course, removing the dentures when you're cleaning them. Place a towel in your sink because what you don't want to do is drop it and then have it break or have a tooth break off. You don't need anything special. All you need is soap and water. You want to definitely store your dentures in water or denture cleaning solution because you don't want that to dry out. When it's dried out, it's more porous. And you never want to soak them in bleach, hydrogen peroxide. And even if you or your loved one has a full upper and lower denture, they should still see the dentist at least once a year. An oral cancer screen to make sure the dentures are fitting properly, to make sure they're not just full of plaque, tartar, bacteria. Denture teeth can get tartar. It's amazing when you take it out and you got to clean off the denture just like you would clean off regular teeth. Make sure your dentist understands your needs, understands that you may need shorter appointments. What's the best time of day for you? That they may need to keep the chair upright. Don't put you all the way back because if you do have a lot of difficulty swallowing or extra saliva, that's not good for you. And the dentist, trust me, we don't like to treat patients upright because our backs hurt, but we can do it as long as it's not every patient of the day. You definitely want to inform the dental provider of your medications and if you have any implantable devices. Many of the PD meds are dry mouth, and also they can be immunosuppressing medications, which can alter your white blood cell counts. And that can, again, if you have a low white blood cell count, it's like having chemo and your numbers are low. You're risking infection. I'm not sure if any of you have deep brain stimulators, but that needs pre-medication prior to your dental visit. You don't want, it's just like having a knee, a hip. You want a pre-medication of amoxicillin to prevent any bacteria that we may cause to go to that implantable device. Yes. Yes, heart valve replacement is huge. The American Dental Association has changed recommendations. If you go to the dentist and you have a knee or a hip, we don't recommend antibiotic prophylaxis. We tell you to talk to your orthopedic. But heart valve, absolutely, you have to have pre-medication before your dental visit. Very good. Oh, and they would never want to use an electrocautery on you at the dental office if you had a deep brain stimulator. The frequency waves could mess that up. It's kind of like a pacemaker that how they used to be. This kind of just puts it all together. It kind of just tells you it's all related. If you lose teeth, you may feel that your quality of life is less. You may then not want to brush the teeth that you have. Gingivitis leads to tooth decay. Tooth decay leads to tooth loss. Tooth loss can lead to difficulty eating. You may not want to go to the restaurant because you don't feel like you can properly eat what you want, it's all related. If you are on any type of antidepressant medications, anti-anxiety medications, 99% of those cause dry mouth. So the mouth is in the center of everything, whether it's PD, whether it's diabetes, it's all related. One of the biggest things that we see with PD and the type A personality is teeth clenching. People will say, well, I don't grind my teeth. You probably don't grind your teeth, but you clench your teeth. People will clench their teeth when they're sleeping. They'll clench their teeth during the day to avoid a tremor. They'll clench their teeth just because of anxiety. Wear of teeth can cause what I would be concerned with is lack of your vertical. This shows you exactly. Your tooth used to be this long, and now your tooth is this long. You have a lack of the space between your upper and lower teeth, which increases the chances of angular cheilitis, the loss of vertical. So bruxism, when you're clenching, you're grinding, it definitely is seen more with PD patients, but it's something we can look at helping. We can make guards for you as long as it's not a choking hazard. If you have these signs or symptoms and the dentist doesn't say something, you may want to bring it up at your appointment. I clench when I pet the dog. Who would clench when they're doing something relaxing, like pet the dog? I do. I'm a clencher. I also have migraines, so it's probably all intertwined. Other signs and symptoms of clenching is your partner will say, "You keep me up at night." They may hear it going side to side, but you're really clenching first and then grinding. Back in the day, we would call it gritting your teeth. We would see teeth that are flattened, chipped, wear facets. So it's like a puzzle. Your upper tooth fits into a nice little wear facet on the lower. Increased tooth sensitivity. When people have clenching all night long, they'll actually start to see abrasion or a divot at the gum line. And that divot at the gum line, recession, increases your root structure being exposed, which increases cold, hot, sweet sensitivity. So you may have all these wear facets, and the dentist back in the day, I told everybody, you're brushing too hard. It's really caused by clenching. When you're clenching, something's going to give. You're either going to break the tooth or you're going to end up with these little indentations. You might feel jaw pain, tiredness. People come in, I have TMJ. Well, we all have TMJ. We all have a temporomandibular joint. It's the disorder of clenching that affects the muscles and the teeth. If you have this and you're doing it, you also may find referred pain to the ear, an earache, a fullness of the ear, and that's all because of the muscles of mastication that get tense. It's like, sleeping on your neck wrong. My favorite, I can look in and see this, a white line on your cheek called linea alba, white line. It basically is where your cheek or sometimes your tongue gets stuck between your teeth at night. So on your tongue, it may look like indentations. On your cheek, it will look like a white line. And those are all signs that you have been clenching. This kind of just puts it all into play. Clenching can cause head pains, headaches. Your eyes, you might feel that tension headache. Discomfort in the mouth, whether it's the teeth sensitivity, whether it's the jaw pain, inability to open. You might break your teeth. the fullness on the ear, even in your neck, you may feel from the clenching. It's all related. When I was preparing for this presentation, I was kind of reading some articles, and this is definitely something I did not know about. But this article was making these guards for PD patients. And the report had shown that they had benefits from using a dental mouthpiece. They had benefits by both the motor and the quality of life. So it said, there's still a lot more to go. There's more studies that are necessary to look at the effectiveness of a mouth guard. But I think this is something huge. A mouth guard or splint could be a very good adjunct as long as you keep it clean, as long as you're only wearing it at nighttime where food's not getting underneath it. The mouth guard does not prevent you from clenching. You're still going to clench with a mouth guard, but it's going to cushion and protect those teeth. We highly recommend, not because we can make money off of it, but because it works, that you have a custom mouth guard. You can go to Rite Aid, you can go to Walgreens and buy one that you can mold or heat up and mold like a football guard. The problem is if you don't have that perfectly straight across and you're not evenly hitting on the right side to the left side on the front versus the back, then you could cause more problems than good. So if you ever want to try something like that, definitely have it custom made. You also don't want it to become a choking hazard if it falls out in the middle of the night. Parkinson's and no teeth. So traditional solutions that we make for no teeth are definitely removable partial dentures and full partial dentures. Dental implants have been an amazing adjunct for the past 20 to 30 years. However, whether you have a denture or you have implant supported denture, there is no substitute for your real teeth. If you lose teeth, the lack of teeth can cause poor nutrition, weight loss, diabetes, risk of aspiration, loss of confidence, not feeling good about yourself. So why shouldn't I just have all my teeth out and get dentures? You're telling me that the dry mouth, clenching, all of these things are going to risk my teeth. Problems with dentures. Dry mouth also causes lack of retention. You need a lubricant in there. You need spit to keep dentures in place. You have with a denture a piece of plastic on the roof of your mouth that can impair speech and taste. Denture sore spots exist. You can't bite something with a denture like you can with your natural teeth. And without teeth, it can change your entire facial features in dents. If we add mobility issues, dexterity issues, PD patients can struggle with putting them in, taking them out, dropping them, breaking them. And as I said, the lack of spit or too much spit can also affect the denture. There are fixed dental implants where the partial or denture is supported by these implants. They can be screwed in and kept in place. However, anyone with normal dexterity has a hard time keeping those clean, yet alone someone that might have difficulty. And it's a hard thing for somebody else to floss underneath these for you. In an ideal world, that's beautiful. But how many of us have $40,000, $50,000 to pay for that? It's very costly. So the key takeaway, we want to decrease that plaque any way we can. Increase water, increase cleaning of our teeth, making that bad spit into good spit, using a prescription toothpaste, rinsing out our mouth after we eat one cracker, not eating the M&Ms all day long, not sucking on sugar candy. We know chronic inflammation, especially close to the brain, can worsen the onset and progression of many neurodegenerative diseases. We know bacteria in the oral cavity is preventable. Um, Basically, if it doesn't hurt, doesn't mean it's not broken. You want to see your dentist regularly. Definitely those 2 cleanings, maybe 3 or 4 cleanings a year. Whatever works for you, and what works for you one year may not work for you the next year. Things change, medications change. You definitely just want to have a good relationship with your dentist to make sure they understand your needs and that they take the time to talk to you about what you can be doing at home. Questions? Yeah.
I was wondering what your opinion of water picks is.
I'm on the fence on a water pick. Water picks are very difficult to use without cleaning the entire bathroom at the same time. They're very messy. Water picks can be very good for cleaning underneath bridges, underneath areas. I recommend if you're going to use one to use it in the shower so you're already, wet and covered. However, water picks can also, if you have periodontal disease and you're dealing with bone loss, they can push things farther in. They can push things out. But if you have a pocket underneath your gum, it can sometimes cause it to get worse. I personally have never been able to use a water pick effectively on myself. I've chosen not to, but if you find that you're getting good results, go for it, but I wouldn't spend the extra money unless you're already using one. You're welcome.
What about teeth whitening?
Very good question. The question was, what about teeth whitening? Avoid it like the plague. So teeth whitening can be done in a couple different ways. The first way that you see it done most of the time is in toothpaste. What the toothpaste does is it actually is more abrasive and it's going to clean off stain. Yes, it will get the surface stain, but it also can weaken the enamel. As we all get older, our teeth really don't get yellower. It's just we wear away the outers of our teeth, which is enamel. We're showing through to the inners of our teeth, which is dentin, which is yellow. You don't want to take away too much of that outer layer or your inner layer is going to look more yellow. So I am not a believer in whitening toothpaste. Let's go to white strips. Let's go to whitening gels. All of those things are bleach and basically acid. They can make your teeth more porous and more sensitive. If you already have dry mouth and you're fighting dry mouth, I would not use whitening. Wear red lipstick if you're a female and your teeth will look whiter. But that's a very good question. Mm-hmm. Any other questions? Yes.
So you mentioned needing to prior to going to the dentist.
Mhm.
So I'm pretty sure that we're told the dentist yes, but they've never mentioned that. We've never had amoxicillin prior to going. So I guess my question is, how familiar are most dentists with what?
We're not.
Okay.
We are not. What you need to do is talk to your neurologist or your primary care physician. They can write or contact the dentist, even fax them and say, I highly recommend that this patient is pre-medicated for any dental appointment that causes increased bacteria. That would be a cleaning, a dental extraction. Usually for fillings, we don't pre-medicate. Honestly, any dentist that probably is my age, I'm not sure if these implantable devices were even around. Does anybody know when these implantable devices became available? You know, unless you're on staff at a hospital or you're seeing a lot of patients or you're taking the time to really look, even continuing education classes, I'm not sure that they go over that.
I spent a lot of time educating them. And it's one of those things that start having to do with when you have a Parkinson's. Hi Greg, how are you? That's what I got diagnosed with today.
Mhm.
And we have set up a really good relationship with him. Constantly asking me about anything. Actually, one of his dental assistants said, I can't clean your teeth. You have not had enough amoxicillin.
And that is huge. You have to advocate for yourself, whether it's at the dentist, whether it's at the hospital. You have to advocate for yourself because unfortunately, medicine is broken. I say that all the time. I'm so happy I went into dentistry and not medicine because I'm not sure if I could do my job and sleep at night if I was in the medical field. Um, your dentist should be more than apt to answer those questions or find out the answer, even if it means sending you home or giving you the amoxicillin just to be on the safe side. 400 or 500 milligrams of amoxicillin is not going to put you over the edge. We also now, if you're amoxicillin allergic, we have changed to doxycycline for those allergic, and only one 100 milligram pill. The reason for these changes is because of antibiotic resistance. We don't want to be pre-medicating people that shouldn't need pre-medication because then when we really need the antibiotic, it's not going to work. Yes.
I did EBS also, and what I really thought at the moment, is the wires that go going across you, and you can't have the electrical stimulus. I always ask for a hip pad, rather than do it the old way. Or what should I do? I mean,
What wires are you speaking of?
you know, for electrical, which,
The ProfiJet.
yes.
Yes. So from what my research was, the ProfiJet is still acceptable. You can use the ProfiJet. You can use, they can run the autoclave at the same time as you're in the room. The only thing they can't do is those instruments like an electrocautery that uses the same radio frequency. Back in the day, you had to unplug the microwave in the office when someone came in with a pacemaker. Things are different with these implantable devices, but you should be fine with the ProfiJet or the Cavitron. Yeah. Anyone else? Yes, ma'am. 2002. Okay. So I graduated in 1996. So I don't really feel that bad that I had to learn on that. But honestly, the first time I would have learned on that would be somebody walking in my office asking me. It was like the first time I had somebody with a pacemaker and I hadn't seen somebody in a while. I actually called the cardiologist and found out because everything changes, especially medications. Any other questions? He might be a little partial.
Anybody has any other questions to ask?
Thank you. Have a great rest of your day.
Thank you.